With spring in full bloom, it's no wonder that May is also designated as National Asthma and Allergy Awareness Month. The Asthma and Allergy Foundation of America is dedicated to improving the quality of life for people with asthma and allergy diseases through education, advocacy, and research. Ed Neuzil, registered nurse practitioner at Allergy, Sinus and Asthma Family Health Center, explains what asthma is and how allergies can contribute to the condition.
Well, when we're looking at asthma, it's simply a reversible airway obstruction. When we're looking at a tree, like a bronchial tree, we see the big trunk, and as the branches go out, it finally gets out into the leaves. Well, similar situation occurs inside the lungs. We have the big breathing tube down the middle, then it divides right and left and divides out until where we finally get the breathing to occur. When we look at asthma, we're looking at the transport. What gets the air from your mouth, your nose, all the way out to where you breathe. So it's merely a transport. When we look at asthma, we're looking at obstruction of that transport line. So obviously, if you're trying to fill something, you want a bigger hose than a smaller hose. And asthma gives you that smaller hose. Fortunately, with asthma, we have, because it is a reversible airway obstruction, we have medications similar to albuterol, which is called a short-acting bronchodilator, that helps us reverse that obstruction and give us a bigger hose. A great majority of the people that have allergies do have or develop asthma. Okay, so you may start out with a runny nose, but somewhere along this lifespan, you may notice that you're starting to develop the bronchospasm. If we were to do a spirometry to look at your pulmonary functions, you may actually see that obstruction, and then by giving you a little bit of medication, we can see that reversibility. That is an asthma type condition. But we also can have asthma symptoms whenever we get a virus. People say I have a cold, that can influence their asthma. You get a bronchitis, which can have some reversibility, the mucus production. So all of these can actually trigger asthma symptoms.
You'll find contact information and more about allergies, allergy testing, and treatments at the Allergy, Sinus and Asthma Family Health Center in Lady Lake when you visit the Asthma and Allergies story link at yourhometownhealth.com.